Today I want to talk about brain paralysis or cerebral palsy. Like everyone knows, brain paralysis occur because of a brain damage before or after a baby is born, and it can possibly occur at the children that 3 or 5 years old. So this disease is causes of failure muscle and the ability of motor neuron to function properly. Okay, so let's move to the next part, which is types of cerebral palsy. So, do you guys know how many types of cerebral palsy? So let me tell you guys. So there are 3 types of cerebral palsy. The first one is spastic cerebral palsy. So this type is the most common form of the disorder. People with spastic cerebral palsy have stiff muscle which cause jerky or repeated movements. There are different forms of spastic cerebral palsy depending on the body parts affected. So let's move to the second types of cerebral palsy, which is disconnected. So this type involves slow and uncontrollable jerky movements of hands, feet, arms, or legs. The face muscle and thumb may be overactive and cause some children to make face. People with this type often have trouble sitting straight or walking. This is a last type of cerebral palsy, which is ataxic cerebral palsy. So, this form of the disorder affects balance and depth perception. People with ataxic walk in an unsteady manner and have a hard time with quick or precise movements, such as writing, buttoning a shirt, or reaching for a book. So, what is the causes of cerebral palsy? The exact causes of most cases of cerebral palsy are unknown, but many are the result of problems during pregnancy in which the brain is either damaged or doesn't develop formally. There are most common treatment for children with cerebral palsy, which is physical therapy, medication, surgery, stem cell injection, and alternative therapies.
Epilepsy is a common condition that affects the brain and causes frequent seizures. Seizures are a burst of electrical activity in the brain that temporarily affect how it works. They can cause a wide range of symptoms. Epilepsy can start at any age, but usually starts either in childhood or people over 60. It's often lifelong, but can sometimes get slowly better over time. Many people misconcept the fits as evil possession and prefer seeing a faith healer rather than a doctor. Epilepsy is not a psychological problem that is caused by stress or failure in life. Seizures can affect people in different ways depending on which part of the brain it is involved. Possible symptoms include uncontrollable jerking and shaking called a fit, losing awareness and staring blankly into space, becoming stiff, strange sensations such as a rising feeling in the tummy, unusual smells or taste, and a tingling feeling in your arms or legs. Medicine called anti-epileptic drugs. These are the main treatments: surgery to remove small parts of the brain causing the seizures, a procedure to put a small electrical device inside the body that can help control seizures, a special diet, ketogenic diet, that can help control seizures. Some people need treatment for life, but you might be able to stop treatment if your seizures disappear over time. Occasionally, epilepsy can be caused by damage to the brain, such as damage from a stroke, a brain tumor, a severe head injury, drug abuse or alcohol misuse, a brain infection, and lack of oxygen during birth.
Diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing blood sugar glucose levels to be abnormally high. Diabetes mellitus is a metabolic disease involving inappropriately elevated blood glucose level. Diabetes mellitus has several categories including type 1 and type 2. Maturity onset diabetes of the young, gestational diabetes, neonatal diabetes, and secondary causes due to endocrinopathy. The main subtypes of diabetes mellitus are type 1 diabetes mellitus and type 2 diabetes mellitus, which classically result from defective insulin secretion and or action. Type 1 diabetes mellitus present in children or adolescents, while type 2 is thought to affect middle-aged or other adults who have prolonged hyperglycemia due to poor lifestyle, and dietary choice. Type 1 diabetes mellitus for about 5 to 10% of cases of diabetes. Most cases of type 1 diabetes develop in children or adolescents, but about 20% of new patients are adults. Most patients present with symptoms of hyperglycemia, but some patients present with diabetic ketoacidosis, a clear indication that insulin secretion has significantly deteriorated. Type 1 diabetes is usually caused by autoimmune destruction of the islets of Langerhans of the pancreas. Patients with type 1 diabetes have serum antibodies to several components of the islets of Langerhans, including antibodies to insulin itself. The antibodies are often present for several years before the onset of the diabetes, and their presence may be associated with a decrease in insulin secretion. Some patients with type 1 diabetes have genetic variations associated with the human leukocyte antigen complex, which is involved in presenting antigens to immune cell and initiating the production of antibodies that attack the body's own cells. Type 2 diabetes is far more common than type 1 diabetes, accounting for about 90% of all cases. Most patients with type 2 diabetes are adults, often older adults, but it can also occur in children and adolescents. There is a stronger genetic component to type 2 diabetes than to type 1 diabetes. Type 2 diabetes is strongly associated with obesity, and is a result of insulin resistance and insulin deficiency. Insulin resistance is a common characteristic of type 2 diabetes in patients who are obese, and thus patients often have serum insulin concentrations that are higher than normal. However, some obese persons are unable to produce sufficient amount of insulin, and thus their compensatory increase the response of increased blood glucose concentrations is adequate, resulting. People with type 2 diabetes can control blood glucose levels through diet and exercise, and if necessary, by taking insulin injection or oral medication. How to prevent those diseases? Firstly, we have glycometer monitoring. All patients with diabetes mellitus, particularly those taking insulin, should measure blood glucose concentrations periodically at home, especially when they have symptoms of hyperglycemia. This is done by pricking a finger, obtaining a drop of blood, and using an instrument called a glycometer to measure the blood glucose concentration. Using this technology, many patients become skilled at evaluating their diabetes and making appropriate adjustment in their therapy or on their own initiative.
Diabetes insipidus is a rare condition where you pee a lot and often with the skin. Diabetes insipidus is not related to type 1 diabetes or type 2 diabetes, which is also known as diabetes mellitus, but it does share some of the same signs and symptoms. The two main symptoms of diabetes insipidus are extreme thirst, polydipsia, and peeing a lot even at night, polyuria. In very severe case of diabetes insipidus, a person can pee up to 20 liters of urine a day. Diabetes insipidus is caused by problems with a chemical called vasopressin, AVP, which is also known as antidiuretic hormone ADH. AVP is produced by the hypothalamus and stored in the pituitary gland until needed. The hypothalamus is an area of the brain that controls mood and appetite. The pituitary gland is located below your brain, behind the bridge of your nose. AVP regulates the level of water in your body by controlling the amount of urine your kidneys produce. When the level of water in your body decreases, your pituitary gland releases AVP to conserve water and stop the production of urine. In diabetes insipidus, AVP fails to properly regulate your body's level of water and allows too much urine to be produced and passed from your body. There are two main types of diabetes insipidus. The first one is chronic insipidus, where the body does not produce enough AVP, so excessive amounts of water are lost in large amounts of urine. The second one is nephrogenic diabetes insipidus, where AVP is produced at the right levels, but for a variety of reasons, the kidney does not respond to it in the normal way. Cranial diabetes insipidus. The three most common causes of cranial diabetes insipidus are a brain tumor that damages the hypothalamus or pituitary gland, a severe head injury that damages the hypothalamus or pituitary gland, and complications that occur during brain or pituitary surgery. Nephrogenic diabetes insipidus. The kidneys contain nephrons, which are tiny integrated structures that filter waste products from the blood and help produce urine. They also control how much water is reabsorbed into your body and how much is passed in the urine when you pee. In a healthy person, AVP acts as a signal to the nephrons to reabsorb water into the body. In nephrogenic diabetes insipidus, the nephrons in the kidneys are not able to respond to this signal, leading to excessive water loss in large amounts of urine. Your thirst increases to try to balance this loss from the body. Nephrogenic diabetes insipidus can be present at birth, congenital, or develop later in life as a result of an external factor required.